You're listening to the official OSAP podcast with Michelle Lee, bringing you infection control tips and information to make you a safer practicing clinician. And now, here's your host, Michelle Lee.
Hello, and welcome back to OSAP's podcast. I'm Michelle Lee, and I am very honored today to have as my guest Ann Bottrell, the CEO of the American Dental Hygienists Association. Welcome, Ann.
Thank you so much, Michelle. Happy to be here.
Well, and before I get started, I wanted to share this little bit of information that I just learned, Ann, in preparing for us to talk today that somehow I'd missed along the way, but that not only are you the first dental hygienist to hold this position at ADHA, you're the first former ADHA president.
That's right. That's right.
Wow.
I was president in 1996.
That is wonderful. And I thought, how fortunate for your members to have someone of your caliber and who is walking the talk of leadership. And it's just such a great example. So thank you for all that you do.
Oh, thanks.
For oral health care overall. So I invited Ann to join me today as a follow-up to a podcast that we just did with Joanne Garillion as our guest to discuss the study that ADA HPI, the Health Policy Institute, did with ADHA just recently. And I wanted to talk to Ann about it from her perspective as well. And tell us, Ann, how did this idea come about to do this joint study?
Yeah, it's always interesting to take a look back, you know, particularly almost a year ago, or definitely a year ago now, when we were all trying to make sense of so much uncertainty.
Yes.
So particularly on our staff to staff level, we have a really good working relationship with the ADA staff. Kathy O'Laughlin, the ADA executive director, and I, especially during the early days of COVID, would feel free to just pick up the phone, call each other. What are you doing? What are we doing? We both had formed task forces to manage and assist our members in figuring out their new worlds. So pretty quickly, when we saw the processes ADA was putting into place to collect data on dentists, early on, we said, well, we should probably do this same work in the dental hygiene space. So over time, that initial seed just started to grow. So it really became a reality just through common conversation with the staff, like, let's do it. Let's work together and let's begin to put together a survey instrument that would meet the needs of the dental hygiene community. And it really was a wonderful collaboration.
That's excellent. That's wonderful. What surprised you most about the study, the results?
Well, we had started to get input from the dental hygiene community through our own RDH COVID email address. So we were hearing from hygienists right off the bat. What we didn't know was the overall impact on the profession in terms of hygienists making the decision to leave.
Yes.
You know, either leave their practice temporarily until the COVID-19 pandemic was more under control, or leave the profession completely. That number, I think, was 11.2% had said, I'm leaving the profession completely. So we knew it was happening, but we didn't have the number. So when we got the number, I think we were all a bit surprised about that.
Yeah, it's very impactful.
Mm-hmm.
And I remember in those first few months, OSAP, we were getting phone calls just like ADHA from dental hygienists who were very frightened.
Yes.
We were all trying to reassure people, but also find the right answers in that reassurance.
Well, we really enjoyed our conversations with you, Michelle. You know, same way. It's,
yes.
What were you hearing? What were we hearing? How do we work together to get good, solid scientific information out to our respective communities. So you and OSAP have been another pivotal collaboration.
Well, and that brings me to talk about the editorial that was also published along with these two papers in your journal, the Hygiene Journal, that you wrote, and it was titled "Collaboration During a Global Health Crisis." And I've said it, and I will continue to say it. I think the one positive thing that has come out of this pandemic is the collaboration among oral health care associations across the board.
Exactly.
I know you and I have been part of a call from the very beginning, the early stages, and I think there were about 8 of us or so on this call with several different dental associations, and it's now grown to I don't even know the number, but
like 35 organizations now or more are part of it.
Yeah, that include both the public sector, governmental agencies, as well as private associations. And I think it's one of the most valuable things that's happened throughout this pandemic. And so that we're talking to each other, and we're working together as dental teams should work together, right?
That's right.
Everybody should have a voice on that dental team. Right. But one of the things you said, I'm going to read it because I want to make sure I get this right. But the statement really stood out to me, that there is no single best or perfect response strategy to this pandemic. And you go on to say ADHA's response to the pandemic may need to change over time, but monitoring, I will get this in a minute. Learning and adapting are key. And that is, it's so true. At this point, we don't know. We're still studying, we're still learning about this disease and this virus. And, I wonder how much of the interim guidance will stick and what will change.
Right.
And I thought that was just a very powerful statement that you've already positioned the association, and you're stating that we need to be nimble here.
Right. And, the time frame that we made the decision that I would write the editorial, that was a huge weight of responsibility on my shoulders, because I had lots of thoughts and experiences, but this, I think, for all of us in oral health, is an important historical point in time.
Yes.
So when we're all not here, people will look back at this point in time and say, what did they do? So the other thing that kind of helped me frame my thoughts was I did a lot of research on what happens to the brain when we experience a high level of fear and uncertainty. So when I wrote that piece, it was a lot of what I discovered about how do we help our brains adapt over time during stress. So it is avoiding being rigid. It's being nimble. It's being open to realizing that what you thought yesterday may not apply today. But we also know that when people are afraid, they want answers right now. Dental people are like that, especially dental hygienists. They want the black and the white. They don't really want gray. So we've had to keep repeating that message that, yes, as more science becomes available, as we learn more from each other, it is our core responsibility to adapt and change your mind. God forbid you change your mind. So that was an important piece that I wanted to communicate through the editorial. So thanks for your compliments on that.
Yes. Well, and that's interesting. You said that. A conversation was shared with me just recently, and it was someone talking to one of our subject matter experts. And wanted to know more definitive answers on some guidance.
Yes.
And she said, finally the comment came, the only thing she knew to say in response, I'll get that to you in about 2 or 3 years when we have more research.
I love that.
Because we still don't know everything we don't know yet, right?
That's right. That's right.
Yeah.
And when you're in the health professions, and if you're committed to science and you're committed to evidence unfolding, you have to take that approach because we'll never know it all. We will never know it all. So you just have to be open, humble, being willing to have some debate amongst ourselves about how we want to approach things. To me, that's all healthy. Yes. So we had a lot of hygienists connect to us who were very frightened.
Yes.
And wanted definitive answers. And my team at ADHA, we had to just remind ourselves that, yes, we're repeating a lot of that basic information, but it's important because people need to hear it multiple times before it kind of sinks in.
Oh, absolutely. Yeah. The same here.
Yep.
So the great news from this study was that the rate of dental hygienists having COVID-19 was very low.
Yes.
And
yes.
I think with all the safety measures that have been put into place, we can expect to see, that is one result I think that we can expect to see continue.
Yes. Yes. And, I think being a clinician myself early on in my career, I just know firsthand that infection control is one of the top priorities of dental hygienists. A lot of your members are dental hygienists
absolutely.
Because they're very, very passionate about infection control and prevention. So we were very pleased to see the low rate. And what was also interesting is the dentist study was done like May, June, and ours was done in October. So the ADA HPI team said, well, the cumulative rate for dentists is now 2%.
Right.
So it made total sense. Ours came in at 3.1 and they're at 2.
Yes.
So it says we're doing a lot of things right. And that was something we all felt very proud of, is that our clinicians are actually, I think one of the best things our clinicians are doing, this, Michelle, is screening.
Yes.
The screening piece before patients even get in the operatory. I think our screening efforts has probably contributed to the low rate.
Absolutely. And, and I think that's always been part of the guidance, but maybe one of those areas that people just, didn't pay as much attention to.
Right.
But I think going forward, that's going to help keep flu cases down. It's going to make a huge difference.
Yeah, I think so too. It's one of those things that I think we could both predict will stay.
Yes.
As we come out of the pandemic.
Right. And I know, before COVID, especially I would hear from a lot of dental hygienists, there was a lot of discussion about aerosols.
Yes.
And it seems now we're getting the attention that aerosols have needed, and people are studying this.
Yeah, I think it's an up of the education. You kind of inherently know it, but when that science comes to the forefront, you kind of repay attention to it. One of the things that we know from the hygiene community, clinicians across the country, hygienists are often working in the operatory alone.
Right.
They don't have that extra pair of hands from a dental assistant to help control the aerosols.
Right.
So that's why there was a high risk factor. OSHA came out and said dental hygienists have a very high risk because of those kinds of factors. So I think there'll be some changes in that too. Certainly we're seeing technology change to help hygienists have more tools at their disposal to help control aerosols.
Yes.
I think we're gonna see more assistants and hygienists working together in a dental practice to help control the aerosols. So there will be some advancements out of what we've learned through the pandemic too.
That's great. That's wonderful. What about while we're on kind of on this subject of dental hygienists and returning or staying within the workforce, what about vaccine hesitancy? I know that we are still seeing that across the board with dental team members.
Right.
What would you say to dental hygienists who are maybe a little hesitant about getting the vaccine?
Yeah, I think the first thing is it's a personal professional decision.
Mm-hmm.
And so we have to respect that from our
Yes.
community. Through our collaboration with HPI, we're going to continue to study this and get deeper into the vaccine hesitancy, identifying how many of our community have been vaccinated, and really peel the onion layer back about the why.
Oh, interesting.
So stay tuned for more of
Yes.
that data to come forward. But a lot of that too is getting facts in people's hands so they can make decisions for themselves. And when we first did some advocacy work around vaccines, and we had a social media outreach
Mm-hmm.
that enabled dental hygienists to contact their state governors directly, advocating for availability of the vaccine, but also to administer.
Yes.
We did see a portion of our community say, I don't want the vaccine. I don't intend to do that. Now, that was early on. I wonder over time whether we're going to see some of that hesitancy decline as more and more hygienists do receive the vaccine. But
Right.
again, it's going to be about the data. So we're really happy to continue to work with the HPI team to continue to collect data on vaccines.
Oh, I look forward to that information coming
Yeah.
out. I know, and I shared this when I would talk to Joanne. I was on the edge of my seat because you guys did a great job of keeping that information close. And I was like, I want to know what it says. So I couldn't wait so that when that email came out, I was so excited to open it up and read it. And I was very excited with the results. So and just very proud of our profession.
Yeah, I am too. And there were countless conversations I was in with all kinds of partners and people who were interested in this. And they would ask me questions and I would bite my tongue.
I bet.
I just can't say. All I can say is it's coming.
It's
Perhaps
coming.
you would like to attend the webinar. You'll be seeing the data. But for us too, it was really hard to not openly share it.
I'm sure. Well, thank you. And thank you, Aunt. Thanks for taking time out of your busy schedule. I know how busy you've been. We've all had a very hectic life this past year.
We have.
Coming up on that anniversary of when our worlds changed. But,
right.
But I think a lot of good has come out of the past year. And again, excited to be part of such a great profession.
Yeah, same here. And thanks to you, Michelle, and all of the OSAP members, board of directors. We have really counted on you guys considerably with the data, and you've just done a fantastic job. So what a difference you've made in our community as well.
Well, thank you. So thanks for joining me once again, and everybody stay tuned for more coming out of ADHA and the ADA HPI studies, and we'll bring that information to you when it's finalized. But until next time, if anyone is interested in OSAP membership or ADHA membership, please go to our websites. We welcome new members. You'll find great tools on both of our sites to keep you educated and to keep you safe during these times. And until next time, everyone, stay safe and study the vaccine and get vaccinated. Thanks.
Great.